Order, order. Chris Loder to move the motion.
Thank you, Madam Chairman. It's a pleasure to serve under your chairmanship, and I'm particularly grateful to colleagues from across the House for attending this very important debate this afternoon. Madam Chairman, if you live in Dorset and you ring your nearest NHS dentist looking for an appointment, there is a 22% chance that you will be told that the practice has gone private. If you live in Dorset and you ring your nearest NHS dentist, there is also a 42% chance that you will be told that they are not taking new patients with special or additional needs. There is a 50% chance that you will be added to a waiting list that is over 12 months, and so half of the constituents calling me today could be waiting until May or June 24 before they are seen. And finally, if you live in Dorset and are calling to book a dental appointment for your child, there is a 77% chance that you will be told that the practice is not accepting new child patients. Madam Chairman, these unacceptable statistics are because access to NHS dentistry in the South West has been on an alarming downward trajectory for some time. Today, rural parts of Dorset, many of which can be found in West Dorset, experience worryingly low access to vital and sometimes life-saving dental treatment on the NHS. This is no doubt a widespread issue across the country, which is plain for all to see in the recent flurry of debates and question activity in the House on this subject. Following this debate this afternoon, there is another adjournment debate in the House this evening examining dental care in the North East, showing how this issue is affecting constituents all across the country. According to recent reports, a quarter of the adult population in England have unmet dental needs. But this is despite there being 24,272 active NHS dentists. That's enough for one every 539 people. And yet these statistics can be misleading, as even though there has been a 2.3% increase in the number of NHS dentists this year compared to last year alone, productivity has importantly slowed. As many as half of these near 24,000 dentists have cut back on their NHS work, according to the British Dental Association, forcing more people to either have to choose to go private and shoulder the burden of these additional costs themselves, or to go without and to face the risks of poor dental hygiene that those can bring, such as tooth decay and gum disease. I should be delighted to give way to the gentleman.
First of all, can I commend the honourable gentleman for South West Dorset and all his team of MPs who come along and support these issues. I'm really impressed, Madam Chair, by just how well they do a job. We did it yesterday, we're doing it today. Well done to them. Across the whole of the United Kingdom of Great Britain and Northern Ireland, of course, there are issues. And the member referred to 70% in his constituency. In my constituency, it's 100% of people can't get an NHS doctor or dentist. So does the honourable gentleman agree, when it comes to the options, which are to pay online for people who are elderly, a whole year of subscriptions to your dentist is not possible for many? But does he agree that perhaps the Minister should liaise with the administrations and the devolved administrations in Northern Ireland in particular, but across Scotland and Wales as well, how we can better do this together? Because quite clearly, it doesn't matter where you are in the United Kingdom of Great Britain and Northern Ireland, appointments cannot be got, and dentists cannot be got for those who need it most.
Chris Loder.
Can I thank the honourable gentleman, the member for Strangford, for his short and succinct intervention, as ever. I think the point he makes, is absolutely right, and it confirms that this issue needs addressing for across the United Kingdom, maybe not just the South West. But I'm delighted that he's attended the debate on dentistry in the South West of England. The South West region, Madam Chair, has recently scored 5th out of 7 for adult NHS dental coverage, with only 35% of adults covered by access to essential dental services, which is below the national average. Dorset, however, fares very slightly better, but adults in my constituency and those immediately neighbouring also experience below national average coverage from an NHS dentist. This inequality is also affecting children, who I'm particularly concerned about. Despite faring better than adults, with a coverage rate of 46% in both Dorset and the South West, we still see coverage rates below national average for children to access the NHS dental services. Without these services, we see that almost a third of 5-year-olds are suffering from tooth decay, which is almost the most common reason why children aged between 5 and 9 are being admitted to hospital. Tooth decay is mostly preventable, and so its effects only serve to demonstrate what this lack of access to NHS dentistry is doing to our children. Madam Chairman, we should also ask, why is this the case? Why are we faced with this difficulty? Why is dentistry in England, and particularly the South West, under such pressure? I believe that the answer is, although multifaceted, primarily threefold. First, the National Health Service Act 2006 and subsequent dental contract. Second, the lack of institutional services and its knock-on effects. And finally, the NHS backlog following the COVID-19 pandemic. The National Health Service Act 2006 set out the provisions for agreement between NHS England and dental practices in relation to the services which would be provided and remunerated for. Prior to the Act coming into law, the National Audit Office and Public Accounts Committee both produced reports to the then government on the reforming NHS dentistry, which raised questions about the 2006 changes. These included the urgent need to change the incentive mechanism for dentists to increase their commitments to NHS dentistry, the difficulty for patients in better-off areas to access public health services, and for those in more deprived areas to access any services at all. The reports also raised that there would be a shortage of NHS dentists, a glut of people who would be left without access to NHS dentistry, and no guarantees that the reformed contracts would be enough to commit dentists to the NHS rather than to private practice. I'd be delighted to give way to my honourable friend.
My honourable friend for giving way. My constituents in East Devon regularly contact me about the difficulty in getting NHS dentist appointment in places like Sidmouth, Budley, Salterton, Exmouth, etc. And problems with recruitment and contracts have been compounded, we know, by the pandemic, but that excuse won't wash forever. Would my honourable friend agree with me that additional reforms of the NHS dental system cannot come soon enough for the South West?
Chris Loder.
Thank you, Madam Chairman. Can I thank my honourable friend for his intervention? I wholly agree with him that reforms are clearly needed, and clearly needed urgently, which is the main point I should be sharing with the Minister towards the end of my contribution, my opening contribution to this debate. It is very clear that some of those measures from the 2006 Act do not go far enough, in many cases actually go to deter NHS dentistry provision. But many of these issues, Madam Chairman, have materialised and are evident up and down the country today. In fact, discussions with my own Integrated Care Board in West Dorset, who, as of the 1st of April this year, have now taken delegated responsibility for commissioning dental services from NHS England, of course, have confirmed to me that the dental contract signed in 2006 is simply not fit for purpose, and it actually restricts the ability of the board to respond to the current situation. This is because the terms and structure of the contract make it incredibly difficult for the Integrated Care Board to attract new dentists to work in Dorset, and I'm sure that this is a problem shared by other Integrated Care Boards across the South West. The ability to attract new dental talent, especially those who are working on NHS contracts, is further hindered, I'm afraid, by our specific circumstances in Dorset in not having adequate training infrastructure. I should be delighted to give way to the Honourable Lady.
I thank my honourable friend for giving way, and I wonder if he would agree with me that those of us that are also in very rural parts of the southwest, this problem is particularly exacerbated, and might the Minister be considering to actually put the dentists that we do have onto some form of bus and bringing the dental service to us so that our young people can actually get on and see a dentist, because I think realistically we're not going to be able to attract the number of new dentists that we need to some of these remote locations that we love to live in.
Chris Loder.
Can I thank my honourable friend for her kind intervention? Yes, I wholly agree. Her constituency of North Devon is, of course, not dissimilar to mine in West Dorset, and we share many challenges and many wonderful things, but, of course, many similarities about this topic, and I'm sure that the Minister has heard what my honourable friend has had to say and look forward to hearing what he has to contribute towards the end. Madam Chairman, without a dental school in Dorset, recruitment continues to be a real problem, as staff often leave the county and the region, indeed, after receiving their training, leaving Dorset residents shortchanged in many cases, especially when we pay for one of the highest council taxes in the country. The third impacting factor, which I mentioned a while ago, which I feel that we are all well versed in, is, of course, the backlog following the COVID-19 pandemic. And I wonder, actually, whether we have all fully recognised the pressure that has occurred on dental services subsequent to that point. It is estimated, Madam Chairman, that as many as 40 million NHS dental appointments have been lost since the start of the pandemic. This is exacerbated by a further 45% of dentists in England having reduced their NHS commitment since the start of the pandemic, adding pressure to an already strained system. And so, with a reported 75% of dentists saying that they are thinking of reducing their NHS commitment this year alone, it is important to look at what can and needs to be done to help both dentists still committed to NHS work and people up and down the country, and particularly in the southwest, who rely on these services. And in my mind, there are two primary actions: contract reform and investment, and quickly. Firstly, there are clearly a number of issues with the NHS dental contract, as we have already briefly debated so far in this debate. I have recently written to all 17 dental practices in my constituency of West Dorset, and I am in regular dialogue with the local integrated care board, and they are all telling me that the dental contract needs reform, and urgently. It seems that the current terms of the contract make it incredibly difficult for local boards to recruit new dentists to meet local demand, and I worry that this is not a sustainable situation for our integrated care boards and could make the situation worse if it continues. The contract also seems to include irregular and sometimes near nonsensical patterns of remuneration, which are undoubtedly playing into the minds of dentists considering their commitment to NHS work. I know, for instance, that dental practices are often remunerated for one filling only, regardless of the number of fillings needed for a given patient, reducing the incentives for them to stay working with the NHS. That surely cannot be right. Behind-the-scenes work is also often missed when calculating the work carried out by a practice. For example, if a patient were to require one X-ray examination, 2 fillings, 1 extraction, and 2 appointments for root treatment, this would total over 4 hours of clinical time and would be counted as 5 UDAs, that's units of dental activity, or the way that the NHS measure, should I say, the practice activity. What isn't included in the cost of materials is the nurse's time setting up these procedures, and the receptionist's time booking in the appointments, chasing patients should they not attend, all of which is hidden from the current contract. Transparency is key here. And as part of a wider reform of the NHS dental contract, I know that my constituents in West Dorset who have gotten in touch with me would appreciate a greater level of knowledge and transparency in the requirements for such treatment. As an example, one of my constituents recently had an abscess in their jaw. Like many in such a situation, they called the nearest dental practice. As we know from the beginning of my speech, on calling the practice, there was a 22% chance that they would be told that the practice had now gone private, a 42% chance that they would be told that the practice would be closed to new patients, and a 50% chance that they would be added to a 12-month waiting list. leaving them with an abscess until this time next year. But fortunately, these things didn't happen. My constituent got through, made an appointment, although at which they were informed by their dentist they did not regard this as an emergency, forcing my constituent to go elsewhere and resetting the clock on their wait list. The dental practices that have contacted me have also shared with me stories of the abuse that their staff receive on a daily basis due to the lack of capacity, of the fact that 111 continue to tell people to call their dental practices despite them not holding emergency contracts with the NHS, and the way that the UDA system is a direct contributing negative and unfair factor in the current situation faced by NHS dentistry. Madam Chairman, reformation is clearly vital of this service, and as I have said before, when debating the health and care bill previously in this place, simply throwing money at the problem will not just make it go away, and yet funding is, of course, the other vital area for improvement in this equation. Between 2010-11 and 2021-22, total funding for dental services in England fell 8% in real terms, from 3.36 billion to 3.1 billion. Further, where practices have underperformed, NHS England have previously not released the funding, resulting in an underspend of the national dental budget. But, Madam Chairman, I would like to conclude that my statement here today, by urging the Minister to maintain his commitment to reforming what is, in my opinion, the very unpopular 2006 dental contract, to make vital and necessary changes to unfair remuneration, and to act before the situation gets any worse, and of course more dentists are lost, is very important indeed. I should be happy to give way.
I apologise for interrupting the honourable gentleman in his concluding remarks, but actually, is it not also worth considering whether or not we can improve the role of dental therapists so they can take on some of the roles, that the £50 million underspend in the South West is delegated across the whole area to deal with this issue, and that we encourage people graduating from the Peninsula Dental School, something we're very proud to have in the South West, to actually stay in the area because the demand right now is greatest. And above all, because of his excellent speech and the points that he's made in this, the dental recovery plan that we have been promised is brought forward immediately because we have been waiting too long. Sorry, does he agree?
Yes.
Loder.
Well, my honourable friend gives me no chance to do anything other than agree. But he's absolutely right, and I hope the Minister is hearing loud and clear from the South West that we cannot go on in this situation. There is no need, especially when we have dental underspends, that we cannot take advantage of these opportunities as they happen to arise. But I would also agree with him that I do think we need to find more new, innovative ways of solving this issue to help broadly the very willing dentistry team that we have across the South West today. So, Madam Chairman, I would like to conclude my statement by, again, urging the Minister to take note of all I've said so far, and I'm sure all that my honourable friends and colleagues from all sides of the House, I'm sure, will have to say. But I wish to end my contribution, Madam Chairman, by leaving the Minister with a very clear idea of what we in West Dorset need. Firstly, I understand that there are plans for a substantial dental school in Dorset. I am very pleased to hear of such plans, which I am eager to support, and so I would be grateful if the Minister would be able to share more details of those during his wrap-up. Secondly, NHS 111 needs to understand that the situation that our dental practices are in, and they need to stop directing frustrated patients to an already swamped telephone line system towards dental practices, causing the busy staff to receive unnecessary abuse for problems that are not necessarily within their power to fix. And finally, the contract and the amount of compliance within it does need, as my honourable friend, the member for Totnes, pointed out a moment ago, it needs an immediate review and immediate reform, because otherwise we will continue to lose NHS dentists, and this situation will worsen dramatically. And I very much look forward to hearing from my honourable friends and colleagues in this debate, and indeed the Minister at the end.
question is,